Good afternoon. I'm George Latimer, Westchester County Executive. This is our 2 o'clock update on the status of the coronavirus outbreak in Westchester County. We do not have updated numbers from New York State at this point, which we will be happy to share, that will track for us the total number of positive cases in Westchester County to date, and then also what that represents in terms of active number of cases. When we have that bit of information, we'll certainly share it with members of the press. It's very important because we are tracking two particular numbers. We're tracking the number of active cases, which is the total number of positives, less the number of positives of individuals that were identified as such a week ago. And a week ago today, we had 10,683 people that were tested positive. Those people having gone through a 2-week period of time and the virus not maturing inside of them become a reduction off of the total number of positives. That becomes our active case number. We look at that active case number in light of the other number that we don't have, which is the number of people that are hospitalized. And so we can take a look at that. And of course, sad to say that there are a number of deaths that increase each day. We're having, in round numbers, about 35 to 40% of our population coming from nursing homes and senior centers, since 65% of all those who we lose are 70 years of age and older. And on the other side of the spectrum, those who are age 40 and under have a very small percentage of the death population, something in the vicinity of about 6% or less. And so this clearly is a disease that is creating fatalities amongst those who are already of a certain age and also have a certain degree of illness. And those two factors combined together have cost us their continued neighbor friendship and life here in Westchester County. We do have a breakdown from yesterday, which we did not have yesterday, of the number of communities that have positive testing. And as we've been saying now for the better part of the month, it is tracking the population centers of Westchester County. Yonkers, New Rochelle, Mount Vernon, Greenburgh, White Plains are by far the 5 largest communities, and they are the 5 communities with the largest number of positive cases. Yonkers has 3,051 positive cases based on yesterday's numbers. New Rochelle is at 1,317. Mount Vernon right behind it at 1,313 cases. Greenburgh is at 1,057, including both the unincorporated part of Greenburgh and the villages of Greenburgh together. White Plains City is at 796. The town of Mount Pleasant, including both Pleasantville and Sleepy Hollow, have a number that is also over 500 cases. Portchester Village alone has 521 cases. Ossining Village has 511 cases. Those are the largest sources of the contagion in the county. Pound Ridge is the lowest with 13 cases that have been tracked and known. Buchanan Village has 20 cases, and those are at the low end of the spectrum. This map will be shared with all of the members of the press, our municipal officials, so they can see what our status is. But they do reflect numbers from yesterday, and yesterday's numbers were a little bit lower because we had a very bad weather condition the day before, which affected the number of people that could be tested. Glen Island was closed, Westchester Medical Center was closed. But we look forward to being able to look at the numbers, again, not because we're trying to track the results of a sporting team, but because we want to see what trend lines they show us. Do they show us the continuing flattening of the curve? It takes a number of days before you can draw a firm judgment that the curve is flattened. And if the curve is flattened, that means we will not get that rush against our hospital beds and our hospital facilities of sick people that caused such havoc when other European countries went through the peak of this contagion. There's so many other questions to be asked as we go forward, a couple of other updates. But today I want to take some time talking about the financial impacts, because there's a debate going on right now about when do we come out of this? When do we change back to normal, whatever normal was, and how fast we get back to it? It's my belief, and I think the belief of our administration, that whatever we do, we should do in a regional context. What we've seen, the governors announced yesterday, Governor Cuomo of New York, Governor Murphy of New Jersey, Governor Lamont of Connecticut at the very least, is an effort to take actions that are multiple jurisdiction in nature. If we move as Westchester County by ourselves, we create border issues with Connecticut, with New York City, with Putnam and Rockland counties and so forth. And it doesn't make sense for us to do it alone. It makes sense for us to do it as a region. Many people who live in Westchester County commute into New York City to work. I did that myself for many years in my corporate life. At various times in my life, I commuted to Stamford, Connecticut, or at one point in Basking Ridge, New Jersey, to work every day. So what happens in the other states matters in New York as well. And I think the regional approach to dealing with this makes the most amount of sense. Whether it's a national approach or not, I can't speak to, because there are parts of the country that are very sparsely populated, the Great Plains area, the Rocky Mountains. They're in a different situation in terms of the amount of contagion and the amount of shutdown that different states have. And there's a certain ideology that goes along with these governmental decisions. We don't need to debate that in this forum, but it will be debated out there in the public at large as to what's happening in one state versus another. But the economic impacts of this contagion is starting to become clear to us. And I want to be straightforward about what the impact is in Westchester County. First of all, we know that individuals have been laid off and have lost their jobs. We also know that many small businesses have had to close their doors, and they're teetering on insolvency if they haven't already reached a point at which they're not sure if their business can go on. We are awaiting the implementation of the federal government making decisions that would provide direct resources to people who've been unemployed, and we believe that's going to be happening very shortly. And New York State has made efforts to get the unemployment insurance system back online so that individuals can apply for unemployment insurance and get some money in their pockets, which will help them buy food for their families, pay basic bills and obligations that exist every month. And now that we're in the second full month of this, with the shutdown at hand, it becomes very desperate for people who don't have a job in a family, but have the same expenses of living and surviving that we all do. And we understand that. That's one of the reasons why our administration has proposed a plan that would forego paying any penalties on property taxes, county property taxes, until July 15th. But more importantly, we know that we have to help our businesses get access to the dollars that may be available through Small Business Administration loans. So Bridget Gibbons, who heads our economic development team, has solicited and achieved a squadron of volunteers, nearly 300 individuals, who are now going through training through Volunteer New York's help and their website to make themselves available to help businesses apply for Small Business Administration loan programs, the Economic Injury Disaster Loan Program, and the Paycheck Protection Program. Both of those programs are complicated, and for those individuals who own a small business who feel comfortable filling out the forms and applying for the money, that's fine. But for those that don't, then they can use some assistance, and we're going to try to provide that for you. Bridget and her team will be sending out an email, and she'll be posting links on our website later today. She'll be working through the various chambers of commerce. So if you're a small business person out there hearing this message, what do I do to apply? If you have concerns about how you would apply and you want some assistance in applying, then we would ask you to go to our westchestergov.com website, look for economic development, and find some information there. Or contact your local chamber of commerce, because through Bridget Gibbons, Sherry Asher from our team, Deb Novick, we are working with those local chambers of commerce to try to provide this information and the actual physical assistance in completing the forms so that small businesses can actually get an application in. We're also partnering with the Women's Enterprise Development Center and Community Capital New York on the initiative, along with Volunteer New York, and we think this is going to be a practical, what can we do to help you and what kind of help do you need in order to be able to apply for these loans. We are not going to reestablish the economic health of the county, nor of the state, nor of the nation, unless individuals go back to work and unless small businesses are able to survive. But at this point, while we're still dealing with the healthcare issues, we have to, survive in the interim period of time. And that survival in the interim period of time involves accessing resources that are available. So we encourage you to go onto our website, westchestergov.com, look for information relative to this program, interact with it, get the assistance you need if you're a small business to go ahead and make the case. The economic structure of this county government, the town, village, and city governments of Westchester and our neighboring counties and the state of New York are all very compromised by this. We have lost already, in a very short period of time, a significant amount of revenue from the various sources that the county has of revenue. We've had a dramatic drop in our sales tax and revenues because businesses are closed. There's much less transactions going on that are being taxed. We are estimating at this moment in time that we will have somewhere between a $60 million loss and perhaps as great as a $125 million loss in revenue from sales tax alone. That is a huge amount of money. We are also going to be losing significant amount of money from our hotel occupancy taxes. Hotels are practically empty at this stage of the game. That could be as much as a $10 million loss to the budget. And that's on the front end side of it. We're going to be losing revenues You know that we've taken action to secure our buses so that bus drivers would not be impacted by the COVID virus. And in so doing and cordoning off the front of the buses, people not enter the buses in the rear and exit. And that too will cost us bus revenues, which we would otherwise have in order to fund what we're doing. And that is now going to be a loss of another X number of millions of dollars. We're going to lose money from our parks department. We know that if we're able to open playland in all of our summertime parks, it will be a delayed opening if it opens at all. And we're not sure that that will happen. That'll depend on the status of health, because whatever debate we've had over this park or that park being open, we know that we can't properly social distance on playland, amusement park. We can't socially distance properly at a swimming pool or at a beach or at the ethnic festivals that occur at Kensico Dam or at Ridge Road Park. Those things aren't possible to open unless we know that somehow we're on the advantaged side of this virus. And those are revenues that we're going to lose as well, $5-6 million of revenue. The total price tag could be as little as a $90 million loss and as great as a $150 million loss, $160 million loss of revenue. Our county budget is $2.1 billion, but to lose that kind of revenue is devastating. And so we have put into place a program we call Westchester Forward. It marries to the New York Forward plan that the governor has previously announced. And I assume it's going to be part of what the multi-region is going to be discussing. Under Westchester Forward, we are going to make moves now to reduce the amount of spending in our county budget to try to deal with the loss of revenue. Our first phase of activities involve changing policies that I purposefully put into the 2020 budget as an effort to stabilize our fiscal situation in Westchester County. If you recall last year, we said that we would be able to do a number of different things that would put us on a sound fiscal policy after not having that type of basis for a period of time, that we would add money to our reserve funds, that we would pay as we go for certain expenditures and not bond for them. When you bond for something, you're borrowing and you're paying for the borrowing cost, not the total cost, but you wind up paying more over the long run. And we thought it was unwise to continue those policies. And when we implemented these policies in the 2020 budget, we received a very positive result from Wall Street. The Wall Street evaluators of the county's finances made a statement that really represented a step forward for Westchester County's finances. But what we're dealing with now is the fact that we have to reverse those policies because we have no choice. If we have a $90 million reduction in our revenue, and that may be the optimistic end, we have no choice but to start reallocating money to offset that total situation. Where we stand right now in our circumstances is we are going to reallocate $10 million that we had planned to put to the reserve fund, and we're going to reallocate that to offset the loss of revenue. We are also going to bond for certiorari repayments. Those are the tax reimbursements to businesses when they apply, go to court, and they win a lawsuit, and they get a reimbursement from the various property taxing entities, usually school tax, local town, village, city taxes, and county taxes because of the valuation of their property having been dropped. And there'll be more of those coming because of what's happened in business. But for right now, reducing by bonding rather than cashing up, which is the more prudent way to go, will save us somewhere between $6 to $8 million in the budget. So we'll take the lower number and say $6 million. And the annual pension cost contribution, which is usually made at the end of the year, we intend to bond for those as well. We had that as a practice for many years. I was critical of that practice, but now we've saved money for a rainy day. The rainy day has come. It is actually a fiscal monsoon that has arrived. And that's the truth of the matter. The shutdown of business should be apparent to all, that people are not out there buying, they're not out there spending money. And when they're not spending money, the sales tax revenue, which is the one of two major elements that hold up our finances, is going to be non-existent. And one of the other revenue streams, as I've mentioned, are also impacted. With those thoughts in mind, the three stages that I've just mentioned represent a $21 million savings on the expense side of the budget. The Board of Legislators has taken action on at least two of these three areas. And in all of those cases, that helps offset what we think will be at the front end as much as a $90 million gap. Now, if our estimates are too high and we wind up with less of a gap, that's good news. A lot of it will depend on when the economy starts to move back in the proper direction. We don't know when that's going to be. Obviously, if it takes us until the heart of the fall, these numbers will be on the low end of the problem. The problem will be greater than that. If health officials think that we've pointing ourselves in the right direction and we can get back into business end of spring, beginning of summer, or some date therein, that might be the lower side of the estimate. But at least the actions we've taken today, we're not waiting. This is $21 million worth of savings, money that we will not spend in this budget, and we'll use that to offset the loss of revenue. And as soon as we have the next phase of actions to share with you, we will do that. We will always share it with the Board of Legislators first, where those decisions have to be made by the board, so they're aware of what the statement is, and that you, the public, and you, the press, will be involved in that as well. We do not yet impact the county workforce or the county contractual relationships with these decisions. However, everything is on the table. There is no way that we can be sure that we can close this gap within our own resources unless we put every possible item of spending on the table. There'll be all kinds of speculations. When I speak to the press, you might ask a number of hypothetical questions about what if we're going to do this, we're going to do that. And the answer will be the same. We're studying all of the things, and we'll announce those once we feel we've got a workable way to go forward. With this phase one behind us, there'll be a phase two and a phase three. And as soon as we feel comfortable that we can go forward in a phase 2 or 3 of cuts, we will do those. And we'll do those in concert, obviously, with the Board of Legislators, as is their responsibility on most of these issues. Some of these issues will not require legislative approval, but we're going to brief the board as well. We have respect for our colleagues. We disagree from time to time. We have a right to disagree. They have a right to advocate for what they want, and I have a right to advocate as an executive what I think is wise and defend it in the public arena. But at the end of the day, we are not going to sugarcoat this for the residents of Westchester County. This is a fiscal disaster. It's going to be a fiscal disaster for your town, for your village, for your city, for your school district, maybe for your fire districts. It's going to be a disaster for the small businessman who wants to reopen his business and doesn't know how he's going to do it, with what kind of cash, with what kind of employee base. It's a disaster for individuals. And if they're out of work for an extended length of time, how are they going to be able to meet obligations and payments that they have to make in order to live their lifestyle? This is the second great challenge that goes along with the first great challenge, which is the health of all of our people. And the second one is the economic strength of all of our people. But as I said in one of my Facebook posts, we will not sacrifice people's lives on the altar of economics. We will make those decisions with the economic impact in mind, but we will put public health first. We will put the health and the life of people first. If we can save lives by the money that we spend, by the actions that we take, that, I believe, is the most important role of government. And then the second most important role of government will be to try to put rational fiscal policy into place that follows. We are now going to be digging out of a hole. I had no intent when I gave the State of the County message a year ago, as I've started to execute the plans in my second year, now beginning my third year as county executive. I face a situation that I don't believe is precedented in our Westchester County history. We've had county executives for about 80 years. I don't think any of my predecessors faced a financial burden this great, but that doesn't matter. When you ask for a responsibility, you own the responsibility. You own the responsibility to respond. And I intend to do that. I intend to do that with my executive team. I intend to do that with the help and the assistance and the advice of the Board of Legislators, with the help and the assistance and the advice of the state legislative delegation and of the federal delegation. We look to the federal government to provide a role that will be critical in the solvency of not just our county government, but of local governments everywhere. I was on a call earlier today with representatives of the National Association of Counties, and I heard a speaker that was from Kentucky and another speaker from California, and they each described situations that in their states were very similar to the situation in our states. This is a nationwide situation. And this is, as has been said many, many times before, it's not original thought. It's a test. This is a test of who we are. This is a test of what we believe. This is a test of whether or not we can respond to a crisis that we face. And if it is unprecedented, well, so was World War II unprecedented at that time. So was the Civil War unprecedented at that time. So was the Great Depression unprecedented at that time. And Americans found a resourceful way to deal with it. I'm troubled in that we are about 6-7 weeks into the heart of this contagion. We knew it was coming for some length of time. Every level of government did something about it. We certainly began our efforts in late January to deal with it. But we are only 6 weeks into this. And it is foolish for people to talk about how fast we're going to be over something until you know the depth of what we're facing. And when you've had 600 people, now perhaps more than that, who've lost their lives in Westchester County alone, 10,000 people in the state of New York alone, we are talking about the loss of life that is significant. This is nothing to brush aside. We cannot treat human life so casually and being so held so cheaply that our economic needs will force us to make decisions that could cost additional people their lives. And that is really the balance point that we have. We have a financial problem, and we have a health problem. We have to deal with both of those at the same time. Other items to talk about and report about very briefly. Our Department of Health has added an online tool for people to determine whether they should be in isolation or quarantine and so forth. This is posted on the Department of Health main page of our Westchester County website, westchestergov.com. Look for COVID determination tree. These are the decisions in the decision tree. If you've ever been through one of those things, that will tell you if you need to quarantine or self-isolate, and will help you in real world types of questions that you want to be able to look at. We've been working very closely with the New York's federal delegation, our members of Congress. Few members of Congress that represent parts of Westchester County, our 2 United States senators. They've been very, very helpful. They have gone to bat for us in the federal stimulus package that was recently passed. They're in dialogue now on an additional stimulus package. We thank them for their service. We particularly thank Congresswoman Nita Lowey, who is in her last year of public service, at a time when people start to wrap up their service, maybe ease back a little bit on the accelerator. Congresswoman Lowey, Nita, who's a friend, has done an exemplary job, as has Congressman Elliot Engel and Congressman Sean Patrick Maloney, and our United States Senators Chuck Schumer will be speaking to us this afternoon in a conference call with the other local elected officials of Westchester, and also U.S. Senator Kirsten Gillibrand and their staffs have been extremely helpful to us in all of these different ways, and we thank them for that work. We have established, we'll mention again, our county emotional support line. It is a line designed to help people with their emotional wellness. It's been established through our Department of Community and Mental Health, Michael Worth, the commissioner. I've interviewed him a couple of times on our Facebook Live. As our deputy county executive, interviewed him more recently. This referral line is at 914-995-1900, 995-1900 for those who have issues dealing with emotional wellness and help. This is a very stressful time. This is a time where people's lives are upended. We're not living our lives with the same format and regularity that we did before. Sometimes it's not possible for an individual to pick up that phone, dial that number. So if you're that person's loved ones, pick up the phone, dial the number, explain the concerns that you have, and we'll see if we can be helpful to you in trying to get some equilibrium, which is going to be difficult. All of us have to go through this process in our own way. We want to make sure that we continue to thank our first responders for the work that they've done. They're saving lives every day. Our police, our fire, our EMS, and our healthcare workers, the nurses, the technicians, doctors who are right up and close, right in the face of COVID every day, trying to help save people's lives. And they've done a magnificent job. We have had circumstances that beyond our control that have made the contagion very prominent here in this area, and yet we've managed to protect quite a lot of lives. And every time you see someone who's been ill but walks out of the hospital, goes home to recuperate a little better, you have some sense of appreciation and thanks for the work that these people do. We'll do our best to help those individuals, and we want to thank them publicly. You can go to #MyWestchester or #WC Thank You if you'd like to register a sign of support. I've driven around, I've seen little lawn signs on people's lawns, people taping something to their garbage can to thank people who are serving us for their public service. With that, I'm going to go to questions, try to take any questions out of there from the press. I'm joined by Catherine Chaffee, as I always am, our Director of Communications. If for any reason we should follow up members of the press outside of this format, we're happy to have conversations after our broadcast is over and answer any of your more detailed questions. Catherine, what questions do we have waiting for us?
The first question comes from News 12. They're asking if you can give an update on transforming the county center into a hospital.
Well, the County Center project has been targeted to be completed by this Friday, April 17th. Obviously, we're a couple of days away from that. When last we checked, they were on or slightly ahead of schedule. It's designed to have 110 rooms, about half of them inside the building, and half of them outside the building. And the construction of these hospital rooms, this is not a pipe and drape situation. You may have seen examples of that at other convention centers when we watch the nightly news. But this is sheetrock, hard wall hospital rooms to add to the inventory of those that are available. I gather they will be operative by Friday. Now, the question of their usage and need is going to belong to New York State. The Department of Health is in charge of trying to manage the demand for hospital space. We're very concerned that we would run out of hospital space if we had a high level of contagion and a high level of hospitalization. And of course, as I've said before, it's not an original thought. There are no walls around Westchester County. So if we have 3,000 available beds, add the 110 from the county center to that number, and the hospitals have been adding numbers as well. We will certainly take on neighbors from Rockland County that may not have an available bed, or Orange County, or Putnam County, or from the Bronx for that matter. We don't treat geography as an important factor. We treat degree of illness and the ability to get treatment and cure and to be able to recuperate. So we expect it to be online on Friday, or finished, the construction work finished on Friday. What it takes to make operational a hospital is beyond my knowledge. So I would have to assume by the first part of next week it will be operational as a hospital. How they decide, what kind of patients they decide to send there, all of those are decisions made by the State Department of Health that will be in charge of the operation of it and how they go forth to do that. But the building is coming along. We were there a little over a week ago, or just about a week ago, and it was a little amazing to see where I just seen high school basketball played a month ago to see a hospital ward. But hopefully it will help save lives.
Next question comes from Nikita for News 12 in reference to the executive order to wear face coverings after tonight at 8 p.m. Her question is, how will this be enforced and will it reduce the spread?
Well, I think we have to follow science in what we're told. And if we've reached a point at which there's a mandate for us to wear face masks, I've been doing it generally speaking up to this point. And it seems to me to be an appropriate way for me not to spread, what I have to anybody else. Then now, if it has in fact become mandatory, then we'll follow that. If it's still an advisory opinion, then we would be well advised to do it in as many places as we can. We are trying to stop a virus that is extremely contagious. I think we've all been shocked by the circumstances. Going back to the index patient, the one gentleman who was infected managed to infect over 100 other people who infected people within the one conversations of 3 over the course of a weekend, a mitzvah and a funeral and a religious service. So I think the wearing of face masks makes sense. And if the scientists and the medical professionals tell us to do it, then we ought to do it, and we ought to not debate it in any other kind of a context. This is good advice we're getting. Mom said, wash your hands, wash your hands. Mom said, don't go to work if you feel sick, stay home, rest, take plenty of liquids. All the stuff that Mom said was pretty much true. And that's the direction we're going to go in. As far as the stopping of the spread, we think in Westchester, we are at a plateau. We don't know if that plateau is going to change and we're going to climb further. We might. We believe certainly in more universal testing. We understand that more test sites are going to be opened up all across the state. And to some degree, Nikita, in some of the urban areas where we already have identified a lot of positives, and the chance of spread is much greater with this dense population. And you're seeing it. The cities that I've mentioned share population numbers. They also share density numbers. City of Mount Vernon, Village of Portchester, Village of Ossining, Yonkers, particularly sections of Yonkers, very densely populated areas, very easy for the contagion to spread. So hopefully we'll see that we continue to be plateaued, but if we start to climb again, then we'll have to have more efforts made to better control these things. And I think face masks is just part of that. That was the last question. Okay, very good. So if there are any other questions, please direct them to Catherine Chaffee. For those of you in the media, you know how to reach her. She's been doing a very good job. I want to thank her. I want to thank Emily Lavin, Joe Scamato, the other members of the communications team that make this possible. I am a man of the 20th century, not of the 21st century. Being on these types of communication structures are sort of new to me. I tend to a laptop as if I'm talking into a camera or to a group of people around a table, and hopefully we're sharing some basic information and doing it in a way that would be insightful. We will check to see what the statewide numbers are from the tracker, and we'll make those numbers available as well, although anyone can go on to New York State Health website, COVID-19 tracker, and you can look at the numbers that we look at as well and then do the calculations as you see fit. Once again, this is George Latimer, Westchester County Executive. Thanks for watching. Have a safe day. Take care of yourself. We'll be back again tomorrow at 11 o'clock for one of our Facebook Live interviews. and then we'll join you here again at 2 o'clock unless there's some other action that requires us to move our time, and we'll give you an update at that time. Have a good day.